Hi, good day. I am Norbert Neil R. Marban. Today I will be performing the basic mouth care. It is the act of cleaning the mouth for the purpose of removing the plaque as well as to prevent from cavities that causes the bad odor. The objectives of this procedure is first is to remove the food particles from the around and between the teeth. Second is to remove the dental plaque. Third is to promote the client's feeling of well-being. The safety and security measures of this procedure is first is to make sure to use the clean water. Second is to use the new toothbrush, and third is to follow the correct procedure. Pre-procedural preparation. First is wash your hands. Second is to introduce yourself to the client and identify client's identity. Explain what you're going to do, why is it necessary, and how the client can cooperate. Third is to gather the necessary equipment, and fourth is to provide privacy. So hi sir, mayong buntag. Ako day si Norbert Neil R. Marba, imong student nurse karong adlaw. Sir, unsa ganitong pangalan?
John T. Marba, sir.
So, Sir John T. Marba. Karon sir is atong assess imuhang baba or atong hinluan. Okay ra ba na sir?
Okay na, sir.
Tignan na kung sir if uncomfortable sa imong procedure sir ha.
Yes, sir.
Okay, so magsugod na ta. So first is assess the patient's ability to brush the teeth and rinse the mouth and rinse the mouth. The rationale for this procedure is first is to ensure that his comfort and safety oral inspection for the effectiveness of the care as well as the evaluation. So sir, makatoothbrush ba ta sir?
Yes, sir.
Okay. So next is raise bed to a comfortable working position. Move the patient near to you. So the rationale for this is to prevent liquid from draining down to the client's throat. Sir, pwede tamo pan gamay sir?
Yes, sir.
Sir, so next is lower the side rail and place the towel on the patient's chest. The rationale for this is that tilting the head downward encourages fluid to drain out of the client's mouth and it prevents aspiration. Since we don't have a side rail, since we're using a sofa, we just have to put the towel for the patient. Next is position the overbed table within the reach and adjust the height as needed. Next is put on clean gloves. As you can see, I already put on the gloves. Next is inspect the lips, gums, oral mucosa, and tongue for the presence of any oral problems such as halitosis, tooth caries, gingivitis, loose and broken teeth. So the rationale for this is to determine individual needs. A thorough assessment is required. So next, pwede mga ngat sir. Okay sir, pwede sir. So next is determine patient's oral hygiene practices such as frequency of brushing teeth and last dental visit. So sir, pwede na ako magpangutana sir kung ikapila ka mag-toothbrush sa isa ka adlaw sir?
3 times a day, sir.
Okay sir, very good. Kanos atong last visit sa dentist sir?
Last month, sir.
Okay sir. Next is moisten the bristles of the toothbrush with tepid water. The rationale for this is to prevent the gum from bleeding. Next is apply a pea-sized toothpaste to toothbrush and hold toothbrush over emesis basin. Next is if the client has a natural teeth and he is conscious, let him or her brush the teeth as follows. So sir, pwede na ta maka-brush sir, toothbrush?
Yes, sir.
Pwede na ito gunitan sir? Gunitan lang sa sir ha. So first is hold the toothbrush against the teeth with the bristles at a 45-degree angle. The tips of the outer bristles should rest against and penetrate under the gingival sulcus. Next is pwede na tayo na, sir. Move and 45 degrees. Okay, sir. Very good, sir. Next is move the bristles up and down using a vibrating or juggling motion from the sulcus to the crowns of the teeth. Pwede na tayo brush, sir. Up and down. Okay, sir. Very good. Next is repeat until all the outer and inner surfaces of the teeth and sulci of the gums are cleaned. Next is clean the biting surface by moving the brush back and forth over them in a short 53 strokes. So sir, pwede na to sunod is diri na po sir na
Sir.
next is Next is allow the patient to rinse his mouth thoroughly by taking several sips of water and spitting into the emesis curved basin. The rationale for this is to provide comfort while avoiding any fluid and debris. Watch carefully to make sure that all the rinsing solution has run out of the mouth into the basin. If not, suction the fluid from the mouth. Repeat rinsing until the mouth is free of toothpaste. Bitang mga nga, sir. Okay. Wala na yung bula-bula, sir.
Wala na, sir.
Na. Okay, sir. Pinagpaan. So, next is allow the patient to gargle or rinse mouth with mouthwash and wipe mouth using the towel. Replace artificial dentures if indicated. The rationale for this is that vigorous rinsing loosens food particles and washes out already loosened particles. Next is apply lip moisturizer using cotton tip applicator to the lips to prevent dryness and cracking of lips. This is because that applying lip balm or chopsticks to the chopsticks to ensure the lip is moisturized. Sir, mag-apply tag lip balm sir ha. So next is assist the patient in a comfortable position. Remove emesis, basin, towel, and bedside table. Raise the side rails and lower the bed to its original position. The rationale for this is to provide for the client's comfort and safety. Ano po ang sir ha? Okay, tamo tindog icon gamay sir. Sir. Next is wipe off overbed table and discard towel in an appropriate container. This is to maintain the standard precautions. Remove the gloves and wash hands thoroughly. This is to prevent the spread of infections. And finally, clean and return equipment to its proper place. This is to prepare the equipment for the next procedure. That's all for this video. Thank you.